Hi, my name is Ken Muskoff, and I saw Dr. Tessier for my hip problems.
Afternoon, Ken.
Hi.
You can see here, Ken, this is your left hip, and you can see that the cartilage space is really worn down and the femoral head starts to get more deformed. We start to develop some cysts, and as the shape of the femoral head starts to change over time with osteoarthritis, your ability to flex and extend and rotate becomes more and more limited, and that's what's led to pain and stiffness. How you doing with the bicycle?
Back to just about 100% where I was before I had all these hip problems. Right now I'm bicycling. In fact, I went bicycle riding this morning, but I get out about every other day and did 20, 25 miles during the week, and on the weekends 40 to 50 miles.
We've got our model. It shows a normal hip and the normal cartilage that moves here. And then when we get where the cartilage really breaks down and becomes arthritic, and that's when we get more and more restricted range of motion and more limping and more stiffness. And then finally you start getting bone spurs, and everyone wonders what arthritis looks like. It's when that hip goes from that nice, smooth, shiny surface to something that's really worn down. This little model actually shows a hip replacement. The idea here is to remove the arthritic femoral head and replace it with a ball with a stem on it, and then the socket has a new covering. Ken, here's the x-ray of your new hip. We've got excellent bone ingrowth into the shell. It's very tight, it's very secure, and we've got excellent size and position here of the prosthesis. The wear properties of these newer implants can give patients like yourself that are active a great longevity and great pain relief for a long, long time.
He's always just a cheerful guy to talk to. He'll do an x-ray of your hips and just go every little detail with you and answer any questions.
I really try my very best every day to deliver that message, to be clear, to communicate well, and to put them in a position where they can really make a good, informed decision about their diagnosis and what their treatment options are. How long do you think it took you after your hip surgery to really get your power and your control so you weren't limping?
Well, it wasn't very long at all. And as far as recovery, they're in the hospital. The next day they get you out of bed and bring you down to therapy. First day, can't hardly move your leg, but it starts going really quick. The second day I was already lifting my leg up to a high degree, and I think by the third day I was pretty well moving it pretty good, and I was out of the hospital the fourth day. So recovery seemed like it just goes pretty fast. I can walk, do any kind of sports, can even bend down, put my socks on now. But quality of life has just been excellent.